I'm joined by infectious disease specialist Dr. Brian Conway, joining us today from Vancouver, BC. Thanks for your time tonight.
Thanks for having me.
This projection, which is only at this point a projection by Ontario of 1,000 cases a day, it is foreseeable. Sometimes we hear numbers and you think, oh, wow, I can't see it going there. But considering the province is already seeing, 700 plus cases in and around on a daily basis, that doesn't seem that far off.
It doesn't, and especially now they are reporting an increase across different age groups. So it isn't only parties and private events and gatherings of people in their 20s and 30s. It's extending across several age groups, which is worrisome and which makes these predictions all the more realistic.
Does it seem like perhaps that first group of people, we know younger people have been out as the restrictions were relaxed across the country and socializing with each other. Does it sound now like that group has spread to its contacts, or are we talking about brand new cases that are popping up in other spots?
Well, it's hard to say. I think the epidemiology will teach us which of these two things it is. If it is new contacts that have nothing to do with people who are in their 20s and 30s, that's even more worrisome. And that makes it important for us to test, to trace contacts, and to establish the patterns of spread to intervene as effectively as possible.
But Dr. Conway, how unwieldy does it get to try and trace when you have so many new cases a day?
It gets more unwieldy, but I think I'm heartened by the approval of the new, easier rapid tests here in Canada. I think these needs to be deployed as quickly as possible to address this backlog, to address this problem, because at some point we won't be able to deal with the pandemic effectively. And if that ever happens, that's when we need to reintroduce more severe public health measures, and we really don't want to have to do that.
Okay, let me pick up on a couple of things you're talking about. The rapid tests, which have now been approved in an interim order by Health Canada, they are going to get pushed out to the provinces in the coming weeks. It'll reduce lineups and wait times for testing and results. But will it help with the contact tracing? Do we have the numbers on the other side who are ready to do more of that work and get it done quickly?
Well, my understanding is that in all the larger provinces of Canada, a fleet of individuals to trace contacts is being hired. And this test, this rapid test, removes the need to ship tests to the laboratories and wait days for the results to be obtained. Results are obtainable instantaneously. It will allow not only the tracing of the first order of contacts, but if someone is positive, we can immediately interview them and find out who they might have been in contact with, making the whole contact tracing more effective. We need these tests as quickly as possible to avoid these predictions of cases of 1,000 or more per province becoming reality.
So I guess you bring up a good point here. The person who's getting tested can literally wait there for the test result. They're not going to go home and get a phone call 3 or 4 days later to start a new process. They can start the process immediately.
Exactly. We can find out when their memory is perhaps a bit clearer where they might have been in contact with someone apart from the index case that prompted them being tested, and then go and test them quickly. All of this can be done same day. It increases how we can more nimbly address the pandemic. And that's what we're going to need to keep the numbers down.
Do you ever see a point, or is this just not doable, where you have that person in front of you, they test positive, you talk to them and they say, I talked to, Joe, John, and Jake, and perhaps the testing gets done at the homes of those 3 contacts instead of those people coming in? Because I imagine every time someone comes in somewhere, there's a fear of more spread.
That would be an incredibly smart thing to do. We need to be more inventive right now. We need to contact trace. We need to prevent transmission. And I think these are the kinds of approaches that are going to be required. And at the same time, as we do their test, we can bring a flu shot if we're a healthcare provider and give them their flu shot. Do everything they need at the same time. It's this fresh, innovative thinking that we need.
Yeah. We'll see what happens. We all have our fingers crossed here. Thank you for joining us tonight. Appreciate that.
Let's be safe, healthy, and innovative.
Let's do that.